everyone. Welcome to Empowering Exceptional Minds, the podcast diving into neurodiversity through real conversations with parents, individuals, and professionals on challenges, strengths, and unique experiences. I'm your host, Maayan Glazer-Koren, an educational therapist, ADHD educator, and ASD specialist. At Educational Therapy LLC, my private practice, we support kids and adults with executive function and learning differences toward confidence and independence. This podcast is a collaboration with Wiz Therapy, connecting individuals to providers and streamlining services for neurodiverse communities. Our goal is to share strategies, stories, and insights to empower families, educators, and professionals. Before we begin, a quick disclaimer. The views and opinions expressed by our guests are their own and do not necessarily reflect those of this podcast or Wiz Therapy. The conversations here are for information and empowerment, not a substitute for professional or medical advice. And most importantly, if you are experiencing a mental health emergency, please dial 911 immediately, or you can text 741-741 to reach the crisis text line in the US for support. Hello, everybody, and welcome to another episode of Empowering Exceptional Minds. And today we have Dr. Alex Klein, and I am super excited to hear what you have to say. We're going to talk about PDA, and we're going to talk about parents and how parents can support their children with pathological demand avoidance. We're going to talk about how it looks like with adults, and the challenge is that it's not very known thing that we see a lot, and how the school can support that too. So Dr. Klein, please introduce yourself.
Hi, thank you so much for having me. So my name is Alex Klein. I'm a clinical psychologist in Oakland, California. And I am a new listener to Empowering Exceptional Minds. So I'm loving your podcast. So thanks for exposing me. Yeah. So primarily what I do is a mix of child and adult assessment. That's probably at least half of my practice right there. And the other half is probably made up of various therapy cases. I probably do more therapy with adults than children these days. I also work with couples. I do parent counseling, family therapy. I'd say over the last, decade or so, developed more of a sort of specialty in neurodivergence, so autism spectrum, ADHD, and as we will talk about more, PDA.
Yeah, I'm really interested because PDA was kind of new for me just when I had a client a few years ago, like 3 years ago. That's when I kind of learned about it.
Yes.
And I'm sure many of our listeners don't know what it is. So before we jump into explaining what it is, I'm always asking my guests to tell us a little bit about your personal journey and what brought you to do what you do.
Yeah. So, I think for me, my own neurodivergence, ADHD specifically, does play a role in what I do now, in the sense that I think I sort of learned what it's like to struggle, what it's like to struggle in school, what it's like to not feel understood, what it's like to have behaviors maybe not be interpreted in the way that I think they should be interpreted. My path was one of, pretty early on, I started working with kids, and specifically neurodivergent kids, home-based therapy program, kids who had an autism diagnosis. I sort of had the privilege of getting a lot of training in a model called the DIR floor time approach, which is an approach largely used with neurodivergent kids, autistic kids, et cetera. I became a teacher, and I still sort of identify, I still feel just my heart really, I still feel very connected to fellow teachers, even though I'm not a teacher anymore, of course. I'm a psychologist now. I still feel like a teacher at heart sometimes, and I really like working with teachers in schools and classrooms. So I was a teacher working with really little ones for a while. Then I worked with older, kind of middle school age kids in an autism specific classroom. and that was before going out to grad school. And, I actually developed you got a pretty broad generalist training working with all kinds of folks, not just neurodivergent kids and adults, but all kinds of people. But I'd say, since, getting licensed now 15 plus years ago, I've probably, again, sort of refocused on working with neurodivergent folks. In a lot of different settings, actually, but most recently in private practice.
Neat. Thank you for sharing. I love it that I feel like we all have coming with a personal experience to this line of work. It was the
Yeah.
same for me.
Yes, of
So I was
course.
like, we know what it,
Yeah.
I mean, I know what it is to be a struggle student. I know it. I've been through it.
Yes,
So yeah.
absolutely. Absolutely. Yeah. And I think that, I feel like, even though I don't sort of share the same sometimes I do share the same diagnosis as my clients and sometimes I don't. I've really sort of, I'd say, devoted my career to some extent of really sort of prioritizing listening to and learning from the voices of autistic adults, for example. That was my dissertation. It was sort of like really getting at the views of autistic adults on therapy and providers. But yes, certainly my own personal experience plays into my thinking and how I feel dedicated to the population.
Yeah, this is a neuro-affirming podcast. So just our
Great, love
listeners
it.
to get to kind of know.
Hmm.
We do everything we set our minds to. I'm just letting you know.
Yes.
So I know we kind of threw this acronym into the air of PDA.
Hmm.
So Mary, as I mentioned before, many parents and even professionals have never heard of pathological demand avoidance or just
Yeah.
beginning to learn about it. Can you explain what it is in very simple terms?
Yeah, absolutely. Yeah, it's really common that provide parents or providers too have not heard of it. I would say in very recent years, like it's starting to, it's been gaining some momentum. So more and more people are hearing about PDA. So as you said, right, it stands for pathological demand avoidance, and some advocates have sort of renamed a pervasive drive for autonomy, but we sort of have the same acronym PDA. And this is something that was originally sort of identified by a psychologist named Elizabeth Newsom in the 1980s, and it was sort of thought of as, and still is to some extent, a subtype on the autism spectrum. And at the time that Dr. Newsom was sort of thinking of this as its own distinct subtype, it was a time where there was sort of one view of the autism spectrum as looking one particular way. But my sense is, that these were kids that were still being referred to her clinic, but that there's something different about them that she, in terms of the sort of terminology used and the diagnostic criteria back in the 80s, and all of this has changed a lot, of course, as we know over the years. But she was seeing this as sort of a distinct profile, and largely this is defined as. I will also I would just add that I think that before I kind of heard about this as a subtype, like before there was a name for it that I learned about back in, I think for me it was around 2019. Um, these were kids that I think when I was doing an assessment, I probably still would have seen them as on the autism spectrum. Like they would, like, to me, but they were kids that it was much harder to see the diagnosis unless you're really looking for it, unless you're really hearing. Because I think that one of the sort of hallmarks that Dr. Newsom talked about was maybe using, social strategies to avoid things. And again, at the time of the kind of criteria that she was using, this was sort of maybe a distinct thing that some of the other kids that were getting referred to her autism assessment clinic were showing. But it can be defined as an extreme resistance to the everyday demands of life. Right, so that's why that term demand avoidance, is in there. So these are kids that often, we have some surveys showing a majority of whom are having a really difficult time going to school, attending school at all in many cases. These are kids that I perceive as having a really kind of hypersensitive threat response, and in particular to a perceived loss of autonomy. Where they're not feeling a sense of control, autonomy, and choice. The efforts to avoid demands can look really kind of externalized, like really kind of outward, lashing out, like strong, or it can be very kind of subtle, internalized, like I'm kind of avoiding things in a more subtle way. So those are some of the hallmarks that I see as sort of some of the key components when we're thinking about, what is a PDA profile. As I said, I'd say it's largely thought of as a subtype on the autism spectrum, but there's some debate. There's some PDA self-identified PDAers that are uh I think don't identify as in the autism spectrum, and I respect that. Like I don't really sort of weigh in. This is an area where we need more research, right? Where we need more more understanding over time. So it's not sort of a universally held belief that this is a subtype on the autism spectrum, but I'd say it's a largely held belief in the PDA community. um and I think of it as like a neurotype, right? So it's not an official diagnosis in our DSM, our diagnostic manual for diagnosing. Similar to the way, so sensory processing disorder, for example, is not in the DSM as its own, official diagnosis. Some people have maybe heard of the HSP profile, highly sensitive person. So these are kids. I think of these as like profiles or neurotypes that maybe they sort of also have other diagnoses. HSPs might also be autistic, for example, or it might not be. I think of PDA as sort of similar in the sense that this is a neurotype that may or may not apply, and it may apply in different degrees. That's how I think about it.
Yeah, interesting. Wow, this is really fascinating. I'm like processing everything you say. Because you mentioned HSP, that's me. You
Yes.
mentioned the
Hmm.
the sensory, hello, and
Totally.
I'm not ASD. So
Hmm.
it's really about it's really interesting us as humans, what kind of like things are happening with us, right? That affecting other things. But I
Right.
do have a question because this is something that I noticed a lot. Um, does it is it like, and I also kind of did professional development with this. I recently just gonna finish one that is PDA, so I'm really interested to kind of
Mm.
see where it takes us. But thinking about it, is this a nervous system? Um, it's like an attack on the nervous system. What will we see? Because you said
Yeah.
lashing out, it would be like a behavior that maybe look like maybe an anxiety.
Yeah, really good question. I mean, this has been referred to as a nervous system disability because I do think it's sort of that kind of hypersensitive threat response to, again, that perceived loss of control or loss of autonomy. And it could look a number of different ways. So there's a lot of ways we could avoid a demand or perceived demand. Like maybe we'll say, yes, we'll do the thing, but then we'll find some way to, weasel out of it. Or maybe for another kid, it's like, oh, well, I can't brush my teeth because I'm a cat, and cats, don't brush their teeth, right? So, or for another kid being told to, do something that they don't want to do, that they weren't the one to choose or make the choice to do it. Yeah, maybe it is sort of a lashing out, yelling, that kind of thing. So, I think that the way we avoid the demand, can really look a lot of different ways. It's quite variable in my experience.
Oh my gosh, you're talking, all I have like this, like I have a folder that I'm going through my brain right now with my clients. I'm like,
Hmm.
oh my gosh. And one of them was not diagnosed with autism on the autism spectrum. She was misdiagnosed until she was 16. And
Hmm.
then my colleague and I saw, we worked with the same client and we saw some red flags and we told
Hmm.
mom, hey, we think there is a misdiagnosis. Yes, there might be ADHD here, like it is sad, and anxiety for sure, but the anxiety is way too high with like things that even opening a computer, which it was considered as a, an attack on her nervous system.
Hmm. Hmm.
So this is how I came into the PDA world
Oh,
with that
interesting.
specific
Yeah.
one.
Yeah.
Um, and then when she did the assessment, redid the assessment at the age of 16, since she was 10, then didn't do an assessment. And then she was diagnosed autism. But like you said, there is no like really a PDA diagnosis that can be attached to
Right.
it.
Yeah, and it's really common, I think, for these diagnoses to be missed. I think, in recent years, we're sort of expanding our definition of the autism spectrum, and maybe that this is part of it. And I think, the anxiety diagnosis might very well be accurate because I do see, anxiety as like a very common part of PDA and sort of
Mm-hmm.
goes into that threat response, anxiety around not having a sense of autonomy and control, uh, you know, um, but I also see a misdiagnosis, really common, for sometimes kids to, get maybe an ODD label, like an oppositional
Yes.
defiant label, which I think is, pretty problematic because it really is sort of doesn't really tell us anything about the root cause of why we're seeing defiant behaviors. I mean, I'm sure in a lot of these cases on the surface, like there are, the kid is, pushing back and not being, super compliant and just easily doing what other people want them to do. Sure. But, the key question is, well, why is that? And I see a lot of people who've received that ODD label. And I'm going to see a disproportionate amount of kids like this in my practice, but they received, an ODD label, but really, what we were talking about is more of a PDA neurotype there.
So we are kind of touching the assessment piece,
Yeah.
which is a really big challenge, and to tease it out, right? And
Yeah.
how we get the right assessment. Uh, so how can clinicians can evaluate PDA?
Yeah, great question. Because there's not a lot of formal tools available. There's one questionnaire that was called the EDAQ, the Extreme Demand
Mm-hmm.
Avoidance Questionnaire, that would be for parents to fill out. They sort of distilled down that into 8 items. It used to be, I think, 20 something or more items on the EDAQ, to kind of 8 core items. So it's now renamed the EDA8. Right, so this is just one, questionnaire, that's sort of measuring degree of demand avoidance symptoms. There is something called the DISCO, which is more used in the UK, as far as I know. I think it stands for Diagnostic Interview for Social Communication, something or other. And there are some PDA specific questions that I don't feel like we need to ask all the questions on there, but I sort of adapted some of those questions. But I think that, because I really value parent interview. I really take a parent interview and this is extremely seriously, right? I
Mm-hmm.
think that like any assessment that does not weigh pretty heavily a parent interview and spend a lot of time talking with parents about what they observe, is really might be missing the mark. And I would say in these cases, there are one of the things that you hear about in PDA sometimes is sort of a Jekyll and Hyde type of thing, where maybe the kid isn't really showing, much in terms of differences or behavioral challenges in the school setting, right? So then you might have, a teacher fill out some questionnaires, which I still do. I still think is important. Sometimes I'm still doing a school observation. Sometimes I'm still talking to teachers. But what can sometimes happen is that, a kid is presenting one way in the school setting and they are not presenting the same way at home, right? Whereas the kid, where a kid is sort of with their hopefully most, secure attachment figures, their parents, so they feel most comfortable showing all the things. And some of those kids were really holding stuff in
Yeah.
during the day, that lack of control and autonomy. And then it really kind of comes out at home. They're kind of masking, they're keeping it in. We see this dynamic a lot in PDI. It's not every case by any means, but that is a fairly common dynamic. So that's one thing I'm thinking about and looking for. I'm doing a pretty detailed parent interview. Because I sort of think of this, as largely part of the autism spectrum, I use something called the MIGDAS, MIGDAS, as sort of a really good sort of semi-structured way to interview kids and families. And of course, spending time in direct observation with a kid, clinical interview in whatever way they're able to participate in that. Some of the PDAers that I've tried to assess like have a really hard time because it's a demand or they don't want to, right? So, sometimes we have to be creative and trying to meet kids where they're at. But yeah, so there's overlap with what, any kind of assessment that I might do in terms of like parent interview and meetings with the kid and getting, school feedback with, in terms of the child assessment world. But again, I really feel like the parent interview piece is really important because I might not see demand avoidance in my office, for example, right? But if I might hear a story of, oh, my kid was about to get on their shoes, to go outside, because we had to go somewhere, but then I told them to because I didn't know that they were about to, but then because I told them to get on their shoes, then they felt that sort of threats of loss of autonomy, and then they wouldn't do it, because that just felt like a demand that that sort of anxiety threat response came up. And so we need to hear about this, and we might not, really easily observe this in our session. So that's why I do weigh the parent interview pretty heavily in addition to the other stuff.
Yeah, I want to give a shout out to social media, which I don't do that much,
Hmm.
because what I noticed that there is a lot more like reels of like
Hmm.
neurodivergent couples or parents talking about
Yeah.
PDA.
Hmm.
And I feel like, oh, we're finally getting some exposure of how it looks like and what can
Yeah.
be red flags when it comes to it. But again, you guys,
Yeah.
listeners, this is social media and
Right.
Dr. Google. So please reach out to a professional that know what they do. But it's a
Mhm.
good way to kind of, oh, is this what is happening in my house, right?
Yeah.
Same with YouTube. Yeah. So I'm trying to kind of understand. I have a question. It just popped up in my head. I have
Sure.
no idea why it came into my head. But when you're looking on the research, I'm just really interested. I'm curious. How many PDAs profiles we see now that are is there different difference between male and female?
That is a good question, and that I think is something that we do need better research on. We know in general with ADHD and autism spectrum, girls, female socialized as female at birth, these diagnoses are more likely to be missed. Right. And so that's why we need to be careful when we say, like, oh, like for every four kids diagnosed, that gets an autism diagnosis for every four boys, there's one girl. Well, actually, it's like, well, maybe this is sort of occurring, all across the gender spectrum equally, but we've just been missing the profiles. So I would say similarly, that could be similarly true with PDA. But as I said, like, this is not an area that we have enough research for yet. It's like we really need to do better in sort of getting more research because that's a really good question.
Thanks. Well, I have another one.
Yeah.
Because like I hear you talking like, okay, I have questions.
Yeah, I
Um,
love it. I love it.
because I was thinking about you mentioned the word masking,
Yeah.
and with females, I work with late diagnosis women
Hmm.
and females a lot, and I noticed a lot of masking that
Yeah.
they've been doing through their lives, and how how can we see that with PDA?
Yeah, I mean, I think it could absolutely play out in a similar way. I mentioned sort of, the Jekyll and Hyde thing, or maybe, the more internalized profile of PDA, sort of maybe, not having an outward response that's going to make a scene, draw, negative attention. But yeah, I mean, I do think these things get masked, which is why, I really think it's so important for folks to know that, like, even if they're not seeing an issue in other settings like a work setting or a school setting, this could still be, like we really need to think about, like, well, what are stressors, even if they're not observable to the employer or to the school administration or to the teacher. What are stressors that sort of lead, that have a real cost on the PDA. I think this is a super important concept that I like to think a lot about because oftentimes there are some real stressors. But again, they might be quite masked, quite hidden to others, right? And, and what's the cost of that over time, right? So this might be a kid who, eventually can't go to school anymore, or somebody that really kind of burns out at work because maybe, their diagnosis again wasn't obvious to others. So they didn't have a diagnosis to advocate for work accommodations, for example, and then therefore burnout might be more likely. And I'm speaking in generalizations, but I do see this dynamic happen a lot, and it's a good thing to think about.
Well, we're getting to the meat of it. So what can we do at work? What can somebody PDA can do at a workplace when they're juggling also family or in the family system when we are looking on relationships with children or with, I know that's a huge question, with children, with their significant other. And I'm
Yeah.
going to leave school alone for a second because I'm in the adult life. What can we do?
Yeah, that is such a good question. I feel like it's so individualized that it's almost hard to talk about in the abstract. I mean, one of the things that
Mm-hmm.
I do, I mean, we have to think about like what's practical for this person. So, for example, like there are people that could, they have the type of job where they could get, a provider maybe to get them on a 12-week leave, of absence to kind of maybe have a bit of recovery time if they are really kind of burnt out from the job, for example. Or there are folks who are able to, access a diagnosis and, go through their HR or something to get some work accommodations, right? There are folks that are just not able to do that, or they don't have a kind of
Yeah.
job that can do that, or and so it's really variable, how we want to think about this kind of thing. But it's true. I mean, I think, this is one thing I talk about a lot. You mentioned sort of like the demands of having a job, but also parenting, family life. One of the things I talk about a lot is how in the last administration, the Surgeon General talked about, parenting as a public health crisis that parents, and it was like roughly half of parents speak about parenting in general as just being like completely stressed and overwhelmed every single day, right? And so when you have, your own neurodivergence or neurodivergence in your kids, because oftentimes these things happen, and then you have that combined with a lack of adequate societal support and understanding of these neurotypes, like this is a hard recipe, and this is why, we as a field, I think, need to do better in understanding, how to identify and support these families for sure. But yeah, I mean, it is a tricky thing, like thinking about what is feasible, what's practical. How do we find ways, can people find ways to to let the dust settle of their nervous system? Sometimes it's like, can we find windows to take some breaks? Are there ways that people can find a little windows to protect their nervous system in some way, right? And that's going to look different for different people. Like for one person, that might be, no, I actually need to find a job where I'm working from home because the overstimulation and the lack of, the demands from my boss is too much. So like, maybe one person could find another job where there's more autonomy and flexibility, but that again, it just depends on the person and what's practical for them.
That sounds so hard
Yes.
when you're an
Mhm.
adult and you need to deal
Yeah.
with a lot of demands because
Yes.
honestly, most of the day, it's demands. Your boss,
Right.
your children, your spouse,
Yeah.
functional living, doing
Hmm.
the dishes,
Hmm.
and
Yeah.
taking care of yourself.
Right.
So,
Right.
what
And
language can we use for that to kind of help navigate, let's say, a parent of a PDA child? Is there a way of communicating in a way that will not sound as a demand?
yeah, good question. I mean, I think, one of the things I like to think about, I just want to say first is
Mm-hmm.
sort of like what is at the root of the demand avoidance, right? And I think for these situations where, a kid has just been completely overwhelmed and they just don't have any gas in the tank, right? It's like, can we reduce the overwhelm, reduce the stress to give them a little more capacity? I mean, that's one thing I think about for kids is like, what is causing the overwhelm and stress and therefore all the demand avoidance? For another kid who it's like, they might have all, no real stressor. Most people do have some amount of stressors, I think, but but still that, that lack of autonomy and control. Maybe we use, you might have heard the term declarative language,
I
right?
was
Like,
just wanted to say that.
yeah, right. Like, so like, oh, I see your shoes right there. Oh, I can't wait to see what's going to happen at this next thing that we're going to. Like, instead of saying, go put on your shoes, oh, your shoes are right by the door. Like, you're kind of, it's different, right? So that doesn't feel as much like a demand. Like, hey, stop what you're doing and get your shoes on, right? It
Right.
might be like maybe we were spoken to that way, when we were kids, or maybe that's more of like a standard thing. Like, yeah, stop what you're doing, get your shoes on, right? Not going to work for every kid, right? That might really activate another person's threat response, which is why the declarative language is one of the things thought, we talk about in a PDA, in the
Yeah.
PDA world.
There's a great book about it by Linda K. Murphy. She's a
Yeah,
speech and
Linda
language
Murphy.
pathologist.
Yeah.
Yeah, so
Hmm.
Declarative Language Handbook.
Yes.
Yeah, we actually teach that also in our parenting workshop, that what is
Oh,
the difference
great.
between declarative and imperative language when we're asking kids.
Yes.
Because our kids, and I'm thinking about it too. Think about school. Yeah, they're in school, they're sitting in the classroom if they can go to school, our
Hmm.
PDAs, and the teacher is directing all
Hmm.
day long, they're being directed.
Yeah, good point. Hmm.
So that's a lot of, and if they need to hold themselves and their nervous system,
Yeah.
man,
Yeah.
of course they will come home and be like, kaboom.
Right. And one of the things I think about is, for kids who maybe have a hard time being flexible, just sort of adapting to what the teacher's expectations is in terms of the work to do and when to do it. I find that with the PDAs, like, if we meet that difficulty being flexible with, also as adults, if we are also having difficulty being flexible, like, the inflexibility meets the inflexibility, like, that is not a good recipe. So that's, again, why we talk about, like, how can we as adults, as teachers, as administrators in school, as parents do at home, like, how do we kind of meet their difficulty being flexible with more flexibility, more choice, right? And I do think, as teachers and as a former teacher myself, like, we might go in with sort of an agenda of, like, this is what the class is supposed to do, like, this is what the kid is supposed to learn, and so I do think it's often worth advocating, particularly if a kid has an IEP, for example, right? Like, how do we sort of advocate to find windows for the kid to have their own, maybe some more choice, maybe some more autonomy, maybe some more proactive breaks. Like, maybe they're allowed to, explore their passions and special interests more. Because, again, sometimes we're seeing some kind of huge cost of, the kid just we're trying to put the kid in a box, and some way or another it might not work. The kid might break out of that box, or might stop entering the box in general, stop going to school in general. So yeah, I mean, again, every case is different. Like, how do we think about how to support any given person? It is super, I think it's individualized, but those are some things that come to mind with that.
Yeah, I think that, I've been in education many years of my life,
Hmm.
and I'm sure I had PDAs when I was teaching, and I never saw that.
Hmm.
And I know
Hmm.
I'm not the only one.
Yeah.
And
Hmm.
I think we do need to have more of like education and teacher training
Yeah.
about what it is and how it looks like in the classroom.
Yeah, me too. Me too. Yeah, and I think, PDA North America is one of the US based organizations. They've been doing a really good job in developing more teacher training related materials. The PDA Society in the UK is a really good organization that does have stuff around, around schooling. But yeah, you're right. It is under recognized, and an area that an area of growth for all of us, right? How do we recognize, understand, support, this neurotype?
Yeah, it just makes me sad to
I
think that there are
know.
so many
Me
kids
too.
out there
I
that are
know.
not being seen. And I'm thinking also about my clients that are PDA. And
Yeah.
I do have a question for you for adults that, are
Mhm.
dealing with, um, especially in a relationship with their partners. Um, how do we go? Again, this is where declarative versus imperative language can play a role, which means
Mm,
we kind of need um, to learn communication skills when it comes to that.
mm-hmm.
So what do we do with like chores, right? That are part
Mm.
of our life.
Yeah, right. Because, in a partnership, it's not as simple as like, oh, well, my partner's PDA, so I can never ask for anything or they can't do anything. Like, no, I mean, there's going to have to, that generally does not really work. Um, so I think it's like, how do we go about trying to have, first of all, some true empathy and understanding going in both directions about why things might be hard is always a really important concept. I think, trying to find ways to be really collaborative and, the PDA partner maybe having, more choice. I use concepts of collaborative problem solving that Ross Greene, the psychologist Ross Greene, who writes about in the book, The Explosive Child,
Yeah.
that's mostly about, working with like parents and children or schools with children. But these collaborative problem solving concepts can certainly be applied in partnerships too, right? Like, how do we find ways to still, not, give people a sense of autonomy and control? We're not just saying, no, you have to do things this way or else, right? That's a very kind of demand, but it's more of like, hey, what makes things hard? How can we understand each other? Here's what's hard for me, what's hard for you, like, can you have an idea, or what do you think about one way that we can kind of address these concerns that we have? So sometimes that's a model that I think can be applied, to kids, families, couples, all of the above.
Yeah. And I think it's a model that is good for everybody.
Yeah, me too. Mhm.
Yeah. Like even like, I'm thinking about like things that we do in the parenting workshop. We say, oh, instead of saying go do your homework, say, oh, I wonder,
Right.
or I notice, not in a sarcastic way, but a
Hmm.
non-judgmental tone. And this is really
Yeah.
important too, because I want to be very clear that being neurodivergent, our abilities to hear the tone
Yeah.
is it's like a
Hmm.
superpower,
Yes,
which also
totally.
works against us
Hmm.
sometimes. Um,
Hmm.
but we can hear the tone, so we want to make sure that we are regulating as the adults, to ask the
Right.
question and to say it, and not that we are not regulated ourselves. And you guys,
Right. Right.
we are just talking here, but it's not easy. This is
I
a
know.
lot of self work
I
and
know.
requires a lot of work.
Hmm.
Um,
Yeah.
just saying that out loud, that it does
Yeah, it
require
is.
work, and we get it.
Yeah. And as we said, like, the neurodivergent traits like usually are running in families, right? Like, it's pretty rare now. I mean, maybe not everyone qualifies for the same diagnoses, but there's a lot of overlap between autism spectrum, ADHD. Like, I don't know, I just see just constantly, right? Like, one or both parents shares some traits or diagnoses with their kids. We see it down the family line and the grandparents and maybe the great grandparent. So there's a history in that is important to understand, and sort of how of these. That's another thing that we get into sometimes with families, is like, how are they understood, or how like, what would happen if you didn't do the thing that your parent asked you to do, right? Like, asking an adult parent that, when you were a kid, and what do you kind of carry with you today, right? Or how are relationships modeled for you between your parents, for example? All these things are super interesting, important to think about. And I think when we add the sort of neurodivergence, just there's a lot of complexity there. So I agree with what you said. It does take a lot of work and self-reflection for sure.
Yeah, and also understanding the cultural background as well and the environment you grew in. If you grew in
Yeah.
a different place, or you grew in a
Hmm.
culture that, um, like there is an authority, I can't say the word. Wait. Hello, listeners. Now you're gonna hear me stumbling on my words. Like with authority, like respect of an authority,
Yeah. Hmm.
um, then I don't know, you guys. It's a lot of like, it's really interesting. We have to look at this from more of like a wider lens.
Hmm.
That there are many things that goes with it. But that's true for everything when it comes to therapeutic world
Yeah.
and
Yeah.
communication.
Yeah, for sure.
Oh my gosh. I love this podcast. We can I can keep asking questions, but I know
Sure.
that we are both busy and have clients.
Hmm.
So to respect everybody's time and for our listeners,
Hmm.
What are tips that we can do, like, I know, without generalization? I mean, I know it is going to be generalization, but what will be the tips that we can give our parents and spouses and
Yeah.
adults to take away with
Yeah.
today?
Yeah. Well, I think, staying on the topic of demand avoidance, I mean, I think it is really important to kind of break that down to think about, what is at the root of the demand avoidance. Is this like sort of a burnout from chronic overwhelm, sensory of, overwhelm. So therefore I can't, handle, the request to go into a louder environment. Again, is there the sort of high need for control, the real PDA flavor of demand avoidance, the sort of sensitive threat response system, when one sense of autonomy is threatened. I think, understanding the root of it does give us an opportunity to kind of go back upstream and not just think about like, well, what are we seeing on the surface, but what led to the behavior that we now see in the surface. And I think that's really important to think about, the why behind behaviors, because I think with greater understanding comes greater empathy and more opportunity for some problem solving. Um, I do think, again, coming back to this idea of flexibility, negotiation, compromise as just being like a really important concept to think about in the PDA world for sure. Like, how do we, reflect on our own, tendencies as a, as a parent, for example, or a partner, or a teacher, and really kind of reflecting that, like, is this working, and or is it seem like it's working on the surface, but is there a cost to these things on my child? So I think these are really important things that come to mind. Nah.
Well, Dr. Klein, thank you so much.
You are so welcome. Thank you so much for having me on. I love talking about this stuff, so I really appreciate you inviting me to be a guest here.
Thank you for listening to the podcast. Please follow us, subscribe. We also have a YouTube channel. Please subscribe there as well and help us grow to bring more information to anyone who needs it. We're here for you. Thank you.